Hi, I'm Dr. Vance with St. Bernard's OB-GYN, and I'm here to talk to you all today about how St. Bernard's is preparing and is prepared during the COVID-19 pandemic for all obstetric patients. As of now, I want to reassure that most women are negative and are going to experience a very normal obstetric process. You will be screened when you come to St. Bernard's. If you screen negative, you'll proceed to the 5th floor on labor and delivery just like normal. It'll be a normal delivery process other than the fact that you can only have one visitor with you during the process. That visitor will remain with you during the entire time in the delivery. The only other change that we're kind of working toward is an expedited discharge process, just so that you're not in the hospital any longer than you need to be. And both the obstetricians and the pediatric providers are working toward doing the best we can for that discharge process. Now, if you screen positive, or you are a suspected person with COVID-19, or you're positive with COVID-19, St. Bernard's has prepared for you. We have a completely separate unit that you will go to, and we will make this the best process we possibly can for you. You can still have one person with you during active delivery. That means when we start to push or during a cesarean section. Other than that, what will be different is the people caring for you will have full protective gear on, meaning a mask, eyewear, a hat, gown, and gloves during the entire process. You will also be wearing a mask during the process as well. After delivery, there's a lot of things that are rapidly evolving, so I do like to tell you that things may change even as of later this afternoon. But for now, based on the AAP guidelines, mother and baby will be separated until mother has screened negative and baby has screened negative. This is due to protect your child from getting COVID-19. Unfortunately, these babies are immunocompromised and could possibly get very, very sick. So that does not mean the baby will have no contact with a parent. The other provider, or parent, would be considered the well parent. They will be the one who can go and visit baby during this time. At this time, it takes about 24 to 48 hours to get a test back. We're working on getting faster and faster tests, and hopefully we will even get to the point where we can have a test back in an hour, which would be getting mama and baby back together quicker. As of guidelines right now, we have to have 2 negative tests before mom and baby can come back together. That's for an actual positive COVID-19 patient. A patient who is suspected and then comes back negative will only need 1 negative test for mom and baby to be reunited. At this time, we are also not doing delayed cord clamp because there's a possibility of vertical transfer, meaning the mom giving the baby the infection either through blood, fluid, or nasal, pharyngeal droplets that come from the face. And we are not doing skin to skin at this time. Babies, we have a complete nursery and NICU ready also on the COVID unit to care for your child in a safe environment and to keep them safe from other babies with possible or positive COVID-19 mothers. So I know this is a very scary process. We will still have it where we can FaceTime in, or if you have a different kind of app you want to do so that you can see your baby in this nursery during this time to try to give you as much contact as possible. We will have breast pumps available to you, so if you want to breastfeed, we'll have those pumps there to get your milk going and try to get you ready for when you can have that initial contact with your baby. You can start breastfeeding immediately. We are truly doing our best to protect you and your child and keep you both as healthy as possible, as well as make this experience as low trauma as we possibly can. We are doing vaginal deliveries and trying our best for a vaginal delivery because truly that's the safest thing for both you and the people who are caring for you. However, if needed, a C-section is possible, but at the same time, we are trying our best to do vaginal deliveries for these patients. COVID-19 in and of itself is not a reason for a cesarean delivery. I want to thank you all, and if you have more questions, we will try to address them as we can, but please be patient with us. As you know, this is a rapidly changing process. And so far in Arkansas, we have been doing very well to flatten the curve. Thank you again. This is Serena Vance.